So I realize that there's this concept that I haven't been able to properly explain in a way where people can understand me about medical professionals and insurance companies, and the fact that the two don't necessarily commingle, and oftentimes um, medical professionals don't actually comprehend or understand the insurance companies that they work for, okay, and how you need to code shit and how things need to be in order and how people lose coverages, right? So I just want to use diabetes as an example. Even though a person is pre-diabetic, they're already diabetic. Pre-diabetes can still lead to neuropathy. Pre-diabetes can still lead to a lot of other issues like callus formation, nail thickening, and also blistering and other problems that come with diabetic skin healing. However, when you label a person solely pre-diabetic for whatever reasons you do, because they don't fit the criteria with the A1C and the levels and stuff like that, what ends up happening is that they get temporary care, nutritional programs, and sometimes diabetic supplies until they are labeled a diabetic. However, if they never change it from pre-diabetes because you learn to eat healthy, you exercise, and everything like that, and you learn to control all of your blood sugars through natural ways, the way a person is supposed to, and they remove that label from your thing or leave it as pre-diabetes, after a certain amount of time, insurance companies will no longer cover diabetic supplies. It takes a long time to fight for that diagnosis to be changed to diabetic so you can access. It's not just your testing supplies that gets difficult to get, because some of us will give up on the testing supplies altogether. But when I was looking at when I did the training for Bella to learn her diabetic stuff, her diabetic alerting for my low blood sugars, um, when I realized how long, because I had already been fighting my doctor on putting a proper diagnosis for 2 years, and she didn't want to put a proper diagnosis. I think because she thought I was trying to access diabetic supplies like tests. I hadn't used testing supplies. I had it for emergencies, but I didn't use it until I started having the blood sugars. I didn't start using it again until I started having the low blood sugars again. And so, and even then, I would buy it because of how difficult they made it to get the testing supplies without the diabetes diagnosis. And it took about 2 years, from like 2022 until 2024, when finally I was like, dude, for the community services that I'm trying to apply for, I need a letter from you and a diagnosis to be able to do this. Like, there still needs to be a diagnosis on the chart. That's what it took to get a proper diagnosis on there to be able to access stuff. And still, the diabetes machine that I have today, I bought it myself. That is how difficult they make for you to be able to manage your conditions after they've become chronic. And it's not just for that, though. You also limit the access to physical therapy, which is very helpful for neuropathy. Neuropathy treatments, they exist. They don't get offered to you. And other, like mental health services and eating services, especially when you have other issues that can affect your ability to eat, which can affect your blood sugar. All of these things matter. In order to keep, diabetes is a chronic illness. Even after you get to normalcy, things like infections, things like life circumstances, people dying in your life can be enough stress to put you back into crisis. If you do not understand this as a practitioner because you're new and you don't understand the system, you will not understand the importance for advocating and properly documenting the importance of a person maintaining maintenance. Maintenance care is important. If you don't put on the chart, hey, this person being homeless is causing more blisters on their feet, which is causing them not to be able to exercise properly, which is causing fluctuations in their blood sugar, which, proper access to food, also doing the same. If you don't learn to document all of this, assistance is not only difficult, it's almost impossible to get, because they can't raise the crisis, I guess. That's the only word I can think of right now, and I don't know why that's on my mind right now, but they can't raise the level of importance for housing, food resources, medical supplies resources, treatment option resources, even access to things like canes, special shoes, special braces, special ointments, because your skin is always getting blisters and you're allergic. Sometimes you have skin sensitivities from your inflammatory markers. You have those skin sensitivities that you can't use normal products. And then when even the natural products are causing harm, having to let things dry out on their own, weeks of no exercise, weeks of dysregulation. And then also nervous system regulation that comes with it. But you're okay that once the person goes into that dysregulation, calling them depressed, anxious, uncooperative, difficult, complex. You're okay with doing all that, or not wanting to work altogether. You're okay with doing that once they get to that point, so that you can put them in psychiatric treatment. But even in psychiatric treatment, it's not taken into account. Oftentimes, some psychiatric treatment isn't like that, but some is not. They don't take that into account. Not having access to the maintenance care matters, even if you think that the person is low support. The reason they are low support is because they have access to the care. My mother paying for the access, even if it came with the strings that it came with, was the reason that I wasn't hospitalized as much after 2020. Because I refuse, at that point, I refused to allow you guys to continue, because you didn't understand the system. My kidney disease got better because I changed my diet. Every time my diet is fluctuating, I have allergies, I have asthma, my kidney function changes. I'm going to have to live with that for the rest of my life, even though they changed the classification from acute kidney failure to proteinuria. You changed the classification so that insurance companies no longer had to pay for all the maintenance that it requires for me to keep those kidneys at proteinuria and not acute kidney failure. This has nothing to do with patients being difficult, and everything to do with insurance company loopholes that people do not understand. You don't need to change the classification. You can change the severity without changing the classification of the disease. Because essentially, if I don't get proper maintenance, that can still lead to acute and permanent kidney failure. I have to live with that reality, even though my kidney function is good right now. You still have to do the testing. But even for regular testing, or when they think that I'm being difficult, or that I'm being, whatever, because after an infection or something like that, I want them to do a full test, but they don't understand that that has led to bouts of kidney dysfunction. The wrong antibiotics has led to colitis. I have ulcers. You wanting to prescribe everything orally and making the insurance making it difficult for me to get my suppositories is a pain in the ass. But I need the medication and suppository because it's affecting my ulcers. But you're not listening because you don't understand insurance classifications. That's why when my GI specialist this last time, she's like, wait, are you trying to establish care? I'm like, yes. She's like, oh yeah, some insurance companies do that. Yes, I know. I can't get my medicine until I have proper specialties, but apparently that doctors are having a difficulty time understanding that. Insurance companies as well. And because of people searching for assistance and going through all the complaint process, the reason we're complaining about you motherfuckers is because you're uneducated, and you're choosing to remain uneducated. Because nurses and other doctors around you are telling you, hey, this is why we do it this way. And you don't want to hear it because you want to be up to policy standards. Yeah, policy standards are one thing, but you cannot advocate for your patient's needs, and they cannot be successful in their care plan if you're not understanding how the system works and how difficult the system makes it to access care. You are not helping your patients if you do not learn the policies yourself, because you can't teach your patients how to navigate the system. This goes for ECM workers. This goes for navigation resources. This goes for community services. It goes for all of these. And they're like, well, policy says that you have to. No, you can teach people a certain amount. I don't know why you guys don't implement the whole watch, practice, what is it called, like for people who need to mirror others to learn how to do something. Why you don't do it in front of them once, then do one with them, and then leave them on their own, so that you know that they learned how to do it, if you actually want your clients to be successful, if that's what you truly want. But navigating the systems, insurance companies and pharmacy companies, is really a big pain in the ass. A big pain in the ass. Because for some of you doctors, you still don't seem to understand that medication reactions are real. It took a very long time before I turned to THC, and that wasn't my first choice. And if there would have been medications that helped me without also taking away my quality of life and turning me into a zombie, because that's what will happen now that I can't afford my THC the way that I used to, my symptoms are progressively getting worse. I will end up on these medications, and by ending up on these medications, I will sleep more. It becomes harder to exercise. It becomes harder to do things. And companies are like, well, why don't you just go back to your herbal treatments? Because I can no longer afford them. That's why I'm going back to the societal resources that are available to people like me that cannot afford these things. Because even the treatments, my physical therapist, he's like, well, you're doing less. Yes, because I'm still getting blisters on my feet. And I still don't have my special shoes or insoles. They're still making them, man. Like, I get it that I need to exercise, but there's more than just that. I'm also passing out because of the summer. It's like, I still don't have a proper cardiologist because establishing care has been a pain in the ass. Because I'm by myself. I don't have anybody advocating for myself. And instead of my doctors advocating for me, because they know that there's this hindrance to care, not because I'm not communicating my needs properly, but because they're not listening. I need my doctors and my nurses to advocate with me for my best interest, not just for what they believe is in my best interest, because they do not understand how complex my case is. Because they're choosing not to understand it, because you can talk to me about it, about what I've tried. I may not remember all the names, but I can tell you the symptoms, and I can tell you what and sometimes when you mention names of medications, that will pop that memory. But it's not that I'm unreliable. It's that if you keep making appointments when I'm telling you not to make those appointments, I'm not going to be fully clear. You're not going to get somebody who is as clear as when they are fully mentally there. So keep that in mind. As doctors, as patients, as clients, as pharmacies, if y'all don't work together, insurance companies will continue to do what they do. We have to get insurance and pharmacy companies competing with themselves and not hiking prices up. That's why profit out of healthcare is important. Because if they made universal healthcare what it is, pharmacy companies wouldn't be allowed to do what they do to hike up prices. Facilities wouldn't be able to do what they do to hike up services. The same services would be available to everybody, not just certain people, at certain costs. And people would actually go to the doctor to do their maintenance care before it becomes a disability. You're creating the disabled people in this country and then complaining about the cost of those disabilities. Maintenance care is important for that. Physicals, access to medication, paid time. Employments need to give more paid time for medical appointments. It's that simple. That is something, because if you work a certain amount, you lose your benefits, your medical benefits, and your Medi-Cal and stuff like that. That's what needs to change if you really want to keep people employed. You need to stop making it difficult for them to be employed and still have benefits, because y'all haven't created laws that force employers to give those benefits. So until you are able to do that, it is the government's responsibility, since people are paying into it through their jobs. They can't keep paying into those systems if they don't keep their jobs. So if your essential goal is to keep people employed, then you need to pay for their maintenance care. It's not just take from the peasant class until they're dead. It doesn't serve you or anyone. You're creating the hatred for and the need for war when that's not necessary. Fulfill your end of the deal, and stop using these categorizations to define whether people get medical supplies and access to medical care. Because those simple changes on your chart, having a pre-diabetes versus a diabetes thing, defines whether you have consistent access to your diabetic foot supplies. DME every year with Kaiser made it difficult to get my shoes. So I finally stopped trying to get my shoes, which made my feet so much worse. So much worse, because it was too hard to be fighting Kaiser to get my DME supplies. And it's still difficult sometimes to get supplies. It takes months before you actually get it, especially if it's being delayed by doctors that don't understand why these need to be classified a certain way and the dangers with not classifying it. Because I showed the blisters last September. There's plenty of posts that show what happens to my feet if they don't get proper care. Not having a proper bathroom to do my foot care every single night is affecting my feet. Housing is important for maintenance care. Why insurance companies haven't created housing systems to be a prescription for people, like, hey, you know what? You have cancer right now. You shouldn't be worrying about rent and that stuff. How about you worry about the cancer so you can get better and go back to work? And I don't mean just insurance companies, but like actual employers for large corporations. Although some of them are starting to. I think Costco was making apartments. I hope they make them extremely affordable for their employees. All of these things matter if you want the working class to stay the working class. And they're happy to stay the working class, because most people just want to go to work, finish, and then go out and live their life. Not need 3, 5, 6 jobs to be able to afford rent. And then be too sick if you miss any of those jobs, lose housing anyways because you're living paycheck to paycheck. That's where all the anger is. Not just with politics, but with our medical insurance companies. How you document things matters because of the way the companies, the pharmaceutical and insurance companies, have deemed it that way. It's important. But it has to be as important to you than it is to anyone else. I love you and have a beautiful day.